Hi everyone, I am going to talk to you about euthanasia. Euthanasia is also known as assisted suicide. It has also been termed when pertaining to one's pets as being put to sleep. Euthanasia is essentially a way to medically induce death with less pain and suffering than what trauma would cause. Euthanasia is a very sensitive and controversial topic. Some people feel very strongly for it, some people feel very strongly against it. It is a very personal decision that someone has to make, and as such, it should be left to them to personally make that decision. However, I feel that there are circumstances where it is not fair for you to deny a peaceful passing to your pet. As pet owners, we all develop an extremely close relationship with our pets, or our fur babies, as I call mine. You learn what they like, what they don't like. You learn what motivates them, what scares them, and as such, you essentially become their voice. By knowing your animal so intimately and being their voice, you're able to notice and say, oh, that's not right. They're in pain. They're uncomfortable. There's something wrong. It is our responsibility as pet owners to voice these concerns and to voice the pain and the discomfort and to try to rectify the situation, or at least provide some sort of relief from the pain or the discomfort. Sometimes we don't notice so much that our pet is uncomfortable or they're in pain, or maybe they've just gotten old and they don't play like they used to. When your pet no longer wants to eat or drink or do things that they once loved doing, then it is time to recognize that there's something wrong and consider your options. You can ask yourself some questions. Is it fair to them to feel like this, to feel pain, to not have any zest for life anymore? Can they be helped with therapy or medication? Are they going to be the same after therapy and medication? Is their quality of life what we want for them? Quality and quantity quite frequently get confused. Quantity, most people associate with, oh, they lived a long, good life. Well, a dog can live for 20 years chained to a fence outside, and that's no quality of life. That's the quantity. Some animal, a puppy could only live for 6 months and contract parvo and then die, but their quality of life inside with a family that loved them and nurtured them is different than the quantity of life that the dog who lived for 20 years chained to a fence outside received. There is a difference, and it is important to know that difference. When the answer to any of those questions is no, then it is time to consider euthanasia. No animal should be made to suffer simply because we as humans are selfish and we don't want to let go. It is a personal decision. It is up to the owner to make that choice. We as veterinarian staff, vet techs, vet assistants, as the veterinarians themselves, we can help give voice to the situation. your dog has been hit by a car, they are not going to recover, and if they do, they are not going to be comfortable, they're not going to have a quality life. It is ultimately their decision, but it is a decision that needs to be made. Once the decision to euthanize has been made, then there are other things to consider. In some cases, your only option is to euthanize in a hospital or clinic setting. Your animal has been hit by a car, it is bleeding to death. It is not okay to allow that animal to continue to suffer. If you opt for euthanasia, that's something that should be done pretty quickly. If you have a senior dog who has been diagnosed with cancer or some unfixable disease, then you have the option to euthanize in a hospital setting, or you may have the option to do this at home, surrounded by family and loved ones. It's a more personal situation for you at that point. You get to have them right in your home, you get to say goodbye. And then some people have like special locations that mean something to them and the pet. It could be a park where they've always gone and loved. It could be a camping location where you have always gone on the weekends. So there are different things that are possible in situations like that. Just because the decision has to be made doesn't mean that you can't have some control in making that decision. Once all of your arrangements have been made, then your pet or the pet will be prepped. Their forelimb will be shaved and an IV catheter will be placed. This will allow access by the doctor of veterinary medicine to inject the first and then the second and final medication to complete the procedure. Once the catheter has been placed, typically you are allowed time to say goodbye, to grieve, to love on your pet the final time. The first medication is injected, and this essentially slows down the body processes, the heart rate, the breathing. They become very relaxed, and they appear to have fallen asleep, which is where most people get the terminology put to sleep. The animal is not sleeping, they're just really relaxed. So once that's done and everybody's prepared, then the second injection is made, and at this point the medication stops the animal's heart and it stops the other bodily processes. The animal has now passed on. Once everybody has had their time to grieve and are ready, then other decisions can be made about what will be done with the body. Some people opt for cremation, some people opt to take their pet home and bury them at home. All of these things are acceptable, and again, euthanasia is very personal, so these are all personalized aspects of the situation. The entire process is personal, and some people opt to stay with their pet, some people opt to leave their pet. Both are completely acceptable. Nobody can tell you how to proceed when you've had to make a decision like this. Nobody's going to judge you for staying or for not staying. Either option is okay. Grieving once you have euthanized your pet is another very personal situation. There are certain stages that everyone will go through and that everyone should recognize: denial, anger, bargaining, depression, and then finally acceptance. You have to keep in mind that with all of these different phases that people go through, if anyone gets stuck in certain phases, then they may require a little additional help or support from people around them or even from the veterinary staff. We cater to the people for the animals, but we cater to the people first. So that relationship that you build with them over the years of treating their pet, that is something that you want to maintain, especially in a great time of grief and need like that. If at any point you think that somebody has become stuck in the depression stage, you can reach out to them, you can check on them, you can offer to find services for them. They're all completely acceptable options when it comes to that sort of relationship. Without euthanasia, many animals would essentially just suffer until their bodies could no longer handle it, and then they would die. I personally feel that that is not okay. If we have the option to end an animal's suffering and to allow them a less painful, less terrifying exit from this world, then that is our responsibility for them to do that. So hopefully I've given you a lot to think about, and you will be able to make your own decisions as far as euthanasia goes in your life. Thank you.